We have identified some confirmed cases and asymptomatic cases. Some of the places have been adjusted into medium, high, and high-risk areas, and this has drawn a lot of attention from the society. The provincial government and provincial CPC committee attach great importance to this situation, and yesterday a special meeting was organized at the provincial government level, which mobilized resources from all channels. According to the meeting, we have to stave off from imported cases and contain the domestic spread of the disease. And we also need to cut the spreading of the disease in order to respond to the concerns of the society. We are gathered here at this press conference on COVID-19 prevention and control in Henan Province, and this is the 62nd press conference in Henan about COVID-19. We will introduce to you the latest situation and also answer your questions. And now let me introduce the distinguished guests with us. Deputy Head of the Provincial Prevention and Control Team, Mr. Zhang. Deputy Secretary General of Zhengzhou Municipality, Madam Li Huifang. Deputy Director of CGTN, Zhao Dongyang, and Head of the Immunology of CDC, Guo Yonghao. May I first give the floor to Mr. Zhang for him to give you an update about the COVID situation in Henan. Dear friends from the media, good afternoon. In these days, the COVID situation in Henan has drawn attention from all walks of social life. For yesterday, there were 23 new cases, in which 5 were imported cases and 12 were domestic cases. Asymptomatic cases increased by 20, and there were no suspect cases. And there were also 4 asymptomatic cases that have been removed from medical observations from 0 o'clock to midday of today. We have registered 2 new imported cases and 2 domestic asymptomatic cases, and they are in Zhumadian district of Zhengzhou. From January the 21st, 2020 to August the 1st, 2021, as of 3 o'clock today, we have in Henan Province 1,286 confirmed cases, 22 deaths, and 1,512 patients discharged from hospital. We also have 18 cases that are currently hospitalized. And we also have 32 patients that are currently under medical observation. We have 10 total imported cases. From the statistics at present, the situation is showing fast spread. The domestic cases and also asymptomatic cases locally registered in Henan are all associated with the cases in number 6 hospital in Zhengzhou. The number 6 hospital of Zhengzhou is the designated hospital for imported cases. Currently, we are still at the beginning stage of this infection, and we face severe challenges in containing the outbreak. The provincial government attaches great importance to this situation, and on the afternoon of July 31st, Party Secretary Lo Yangsheng convened a meeting, and he asked us to contain the spread of the disease and also to consolidate our accountability and responsibility, and also take swift and draconian measures to put in place strict management in fever clinics. We also need to consolidate the defense line at the grassroots level and coordinate epidemic control and economic development, and also flood control and stabilization of the society in all fronts. The Health Commission of the province is implementing the instructions from the provincial governments and provincial CPC committee. We are stepping up our political responsibilities, strengthening coordination between different departments, and we are committed to winning this fight. A number of organizations have dispatched a total of 5,400 medical staff to Zhengzhou for the massive NAT program in the city. We are also stepping up management over suspected cases and asymptomatic cases. Strict measures are also put into place for high-risk groups of people and high-risk areas. We are integrating resources and medical experts to transfer confirmed cases to designated hospitals in the city. Some of them are also in isolation. Drugstores have suspended the sales of fever diseases. Whenever someone encounters a suspected case, he is requested to immediately report the situation to competent authorities. Accountability must be put in place, and we also need to improve the overall management of the situation. And also, we need to hold firm the bottom line of avoiding hospital-associated infections. Number 4, we have to strengthen management in isolation points. At each isolation point, we have to make available 300 rooms, and we need to make sure that each patient or each suspected case is put in a single room for isolation. And at the isolation venue, we have to attach sufficient facilities and management for and over those service people, and that includes food delivery people and also janitors. And we do so to cut the spread to a larger audience. Number 5, we also need to strengthen management over special groups of people, and this includes public places in railway stations, airports, and public bus stations. And also the service personnel working on those positions. For high-risk positions, they need to conduct a NAT once in 2 days. And for key groups of people, they have to take the nucleic acid test every week. Number 6, we are stepping up emergent management. Early reporting and early isolation must be put in place. Epidemiological surveys must be conducted immediately when a case is reported. In medium, high, and high-risk areas, public gatherings are forbidden, and for public gathering with a scale of more than 100, they have to be filed and approved in advance. We also need to coordinate the efforts in flood control and epidemic control. We need to avoid slackening our efforts and be mentally prepared for a lengthy fight against this situation. Efforts must also be made in disinfection. The public awareness must be raised. A healthy habit and hygiene must be maintained. The public needs to wash their hands often, wear a mask. We can never slacken our efforts. when the COVID-19 is still there. We need to pay particular attention to areas that's bordering on the urban and rural region. We have every confidence that under the strong leadership of the provincial government and CPC committee, we will be able to overcome the difficulties and claim the final victory against the flood and also the epidemic. Thank you very much, Mr. Zhang. Now, let's start the Q&A session. Please identify yourself before the question. Now the floor is open for questions. My question is to Secretary General Li. I'm from Elephant News, and Zhengzhou right now is having a NAT campaign citywide. But this is the city with 12 million people. How difficult is this program? And what measures do we have in place? Thank you very much for your question. The citywide NAT campaign is an effective measure for us to identify potential cases according to the current situation in Zhengzhou, and in order to protect the health and life security of all the citizens. After carefully analyzing the COVID-19 situation and the flood situation in Zhengzhou, on July the 30th, the decision was made to conduct a citywide NAT in Zhengzhou. In Zhengzhou, we have set up 4,618 sampling sites. Medical teams will be divided into different teams, and on July the 31st, we initiated this program. On August the 1st and 2nd, we plan to spend 2 days to cover the whole population in the city with our NAT program. On August the 3rd, we are going to cover all those left unattended from this NAT program. With the understanding and support of the citizens in Zhengzhou, as of 14/10 of August the 1st, the NAT program has taken 1.24 million samples of nucleic acid tests. The NAT program is well underway, in a process of which the medical staff, they have been very cooperating, and the grassroots level cadres, they have spared no efforts, and they have demonstrated the great spirit of COVID-19 fight. All the residents, they have been very cooperating and understanding. They have demonstrated a strong sense of responsibility and a very high qualification of civility. And we are running short of time, and this is an arduous task. And we are also facing scorching heat these days. So we still face a lot of difficulties and challenges with our NAT program. We hope that all the people in Zhengzhou can continue cooperating with the authority in this NAT program. While doing a good job in personal protection, the public need to go to a nearby test center to take the nucleic acid test. I believe that with the joint efforts from all sides, we will be able to very quickly identify the cases, cut the transmission of the disease, and go back to normalcy as soon as possible. Epidemic control is the responsibility of each and every one of us. At present, Zhengzhou faces arduous challenges in COVID-19 responses. I would like to remind all of you to do the following. First, to participate in the nucleic acid test. When you are participating in other social activities, maintain social distancing, wear a mask, avoid gathering, and second, refrain from going into a crowded place unless necessary, otherwise stay indoors. Third, I urge every one of you to take the vaccine dose, and this is the most economic and effective way to get protected against the COVID-19 disease. I hope that each and every one of you can quickly take the jab so that we can build a population-wide defense line. Last but not least, I'd like to thank all the citizens in Zhengzhou for your understanding and staunch support. Thank you very much. Thank you very much, General Secretary Li. Next question, please. I'm with Xinhua News Agency. My question is directed to Director Zhao. There are some cross-infections in different places in the country, and what specific measures has the CDC of Zhengzhou taken? Thank you very much for your question. In the end of July, there was a large-scale infection in Zhengzhou and in Nanjing, and the pandemic has spread to other localities of the country. And also, on July the 20th, there was a flood situation in Zhengzhou and in Henan at large. Facing the obvious challenges, the authorities in Henan Province has coordinated the efforts of flood control and epidemic response. We have stepped up service and monitoring on the COVID situation. We work closely together with the CDCs at city levels and county levels, and we quickly responded to the situation through the following three aspects. The first is to analyze key information. We carefully studied the situation in Nanjing, and for a number of occasions we have conducted video conferences to convey the instructions from the central government level and from the provincial level. We put together information from all sides and engaged in a dynamic and comprehensive risk analysis of the situation. Second, when the breakout was identified in Zhengzhou, we quickly engaged in epidemiological surveys. We traced people with close contact to those confirmed cases, and we also locked the source of this epidemic and strengthened management and control over key places. And we also engaged in genetic sequencing for this variant. And third, based on the survey of our efforts, we conducted continuous analysis over the variant and immediately submitted analytical report to the Provincial Health Commission and provincial government. And fourth, we put the experimental lab of the city at the very center. We conducted epidemiological surveys. Immediately after the outbreak, we selected 6 professional experts and dispatched them to number 6 hospital of Zhengzhou, and they are directly on top of the epidemiological surveys and contact tracing. They quickly set up different teams for contact tracing, and also we leveraged the mechanism of last year, which features the coordination of different localities such as Xuchang and Pingdingshan. And this includes 37 epidemiologists who have experience last year. Another effort is that we compared the genetic sequencing of the variants. After the outbreak, personnel at Henan CDC have been working around the clock. After 2 days and 2 nights, we successfully came up with the result of the genetic sequencing. We compared with the variants from overseas, and now the result shows that this is the Delta variant imported from overseas. We continue to take draconian measures against the COVID-19. Following government instructions, we facilitated the Zhengzhou municipality to engage in the population-wide NAT program, and we played a supportive role in accelerating the pace of NAT, and we coordinated with third-party testing organizations and local authorities to ensure the timely and completeness of the results. We organized the experts and teams to objectively understand the variant. We raised public awareness on epidemic control, and we coordinated with different government departments in their appeal for public vaccination, so that we have effectively helped the public to raise the awareness in vaccination. And we also dealt simultaneously with the situation of flood and COVID-19. We engaged in a number of publicity campaigns by dispatching provincial level experts to different localities. We spread the knowledge to a larger population. And in so doing, we have also guarded against subsequent cluster infections at the local level. We encourage the public to quickly take the vaccine dose. In the meantime, we have been dispatching 700,000 vaccine doses to Zhengzhou to support the fight against COVID-19 in the capital city of Henan. Next question, please. Thank you very much. I'm with Peak News. My question is to Dr. Guo. As was mentioned earlier, this is the Delta variant that is causing this round of epidemic. So what are the features of Delta variant? We're currently in the summer holidays, so how should ordinary citizens be protected against this variant? Thank you very much for your question. Delta variant was first identified in the end of last year. In March this year, it gradually spread to different corners of the planet. And this is the most widely seen variant in the world. After infected, there is an increasing viral load in the respiratory system of the patient, according to clinical data. It's very likely that the situation may get worse with the passage of time. So I hope the public can engage the following to guard against this variant. First, make reasonable travel plans. Refrain from traveling to different provinces unless necessary. Do not go to a high-risk area. If you have to go to a high-risk area, you have to take note of your travel record and protect yourself along the way. And after returning from the high-risk area, you have to report to your local community. And secondly, as Secretary General Li and Director Zhao have mentioned, we need to enhance personal protection. I need to reiterate again, in all the public places and on public transportation means, we have to wear a mask. Wash our hands often, ensure sufficient ventilation, keep social distancing, and maintain personal hygiene. Avoid going into a crowd and refrain from gathering, and also do a good job in health monitoring. If you show symptoms of short breath, cough, or diarrhea, do not engage in treatment on your own. You need to go to a fever clinic nearby to get to know the bottom of the situation. Also, you need to report to the authority your travel history, your contact history. In that process, you need to refrain from taking public bus. And also, the public is requested to cooperate with the government in NAT, in community level management and control, and also vaccination program. In terms of vaccination, let me quickly add a few sets of data. The vaccine dose that is used currently is very effective. According to a data by Sinopharm, it has an efficacy rate of more than 65%. And for severe cases, it has a protection rate of more than 87%. I hope the public can very quickly take the vaccine dose so that we can consolidate the defense line of immunity in Henan Province. Even after taking the dose, we cannot slacken our effort because we have to combine vaccination with personal protection. And also, I would like to remind the public to access information from public channels. We should not spread rumors, and we need to consolidate our confidence in winning this battle. Next question, please. Thank you very much. I'm with People's Daily and its associated websites. My question is for Director Zhang. So we are now facing a overlapping challenge of flood and COVID-19. So what are the measures that we have in place to deal with the situation? Thank you very much for your question. We have just witnessed an unprecedented flood, and then we identified some new cases of COVID-19. The overlapping effects of this have added to the difficulties that we are facing, and we have to coordinate epidemic control and flood control. And we need to do a good job in dealing with the overlapping effects of the situation. Number one, we need to do a good job in post-flood disinfection. We hope that the health authorities at different levels to engage in disinfection at temporary settlement centers and do a good job in emergent monitoring on similar symptoms. The priority should go to key groups of people and people from high-risk areas. If there is any situation identified, we have to engage in quick response plans. At township levels and county levels, we will dispatch personnel to ensure the basic needs of medical supplies. And we also need to provide sufficient medical supplies, such as masks, to people in need. We have so far dispatched 15 health teams to 15 counties and cities that are hardly hit by the flood. We need to ensure that wherever people are suffering from the flood, there are professional people guiding the locals to fight against COVID-19. And we also need to encourage people from different localities to do a good job in cleaning their living environment so as to be protected against the COVID-19 pandemic. We have formulated a handbook focusing on how should Henan guard against COVID-19 after this unprecedented flood. We are mobilizing newspapers, TV channels, and loudspeakers at the village level to spread the knowledge out so that the public gets trained with the latest knowledge. In addition, we are stepping up routine control and prevention against the epidemic. On the basis of epidemic control and staving off imported cases, we are stepping up our efforts in vaccination. We hope the different localities can quickly meet their targets in vaccination. Cadres at the Health Commission should play a leading role, and they have to come up with plans to quickly expedite the vaccination process and also ensure that the process is conducted in a highly efficient manner. In particular, we have to pay attention to people working at custom clearance centers and also at public transportation stations. We need to prioritize our vaccination program for people that are helping the localities fighting the flood. As of yesterday, a total of more than 10 million vaccine doses have been administered. Starting from today, we are engaging in a vaccination program targeting the young people. Starting from September, the vaccination program will go to people aged between 12 and 14, and by the end of October, the vaccination program will be completed. Thank you very much to all the questions and also to the experts and cadres from different departments. And due to time constraint, this is the end of today's press release. We will keep you posted in case there is any new information, and you are also welcome to get into contact with the health authorities of the province. As you know that Henan right now faces the overlapping challenge of the flood and COVID-19. The province has to carefully implement the instructions of General Secretary Xi Jinping. Under the strong leadership and coordinated leadership of provincial governments and provincial CPC committee, we will be able to fight the situation. We should never slacken our efforts, and we need to play the spirit of epidemic control and prevention, and we will eventually claim a victory against this epidemic. So this is the end of today's press conference. Thank you very much.